Hello, everyone. I'm Loanne Lake, and I am here live in Charlotte, North Carolina, at the lovely Friendship Missionary Baptist Church for the second annual Caring Maternal Health Conference. Today, I'm honored to be your host for our inaugural episode of the Maternal Wellness Matters podcast, which is powered by Caring and a new addition to their conference this year, which is their second annual conference focusing on maternal health issues and maternal mortality outcomes. Today, we are joined by two of our representatives for United Healthcare, Nicole and Yolaika, who will tell you a little bit more about their involvement in today's event. Nicole, we'll start with you.
Hi, I'm Nicole Francis. I'm a community engagement lead for United Healthcare Community and State Plan. We cover all 100 counties.
Okay, and Yolaika, would you tell us a little bit about what you do?
Yes. Hi, I'm Yolaika Rosario-Greene, and I am the clinical practice consultant for our Region 3 at United Healthcare.
Okay, and so you're here today for Caring's conference. Were you here last year for their first maternal health conference?
Yes, we were.
Mhm.
It was exciting, very exciting.
And Nicole, if you would tell us, why is it important for United Healthcare to have a presence at an event like this?
Our mission is to enhance the lives of our members. So when we work with Caring, we are just trying to partner and collaborate to help the community that we live in. We're just trying to give them healthier resources, education. So it's so important to be here because we meet with other organizations that treat our members. So we want to share with them the information that we could give them to live healthier lives.
So, Yolaika, tell me, what is some of the information that you would share with someone coming to your exhibitor table today?
So we love to share about our value-added benefits that our members, Medicaid members, get on top of their regular basic Medicaid. I work on the maternal child health team. So, my focus is on those mom and babies. And so the mothers, they have benefits of $2,200 of value. So that could be their car seat. They could pick a pack and play. They can also, we have benefits for, our newest benefit right now for children, our Highlights magazine. So there's so many great benefits that our members can receive on top of their Medicaid.
You just said highlights, and it took me back because I used to anxiously wait for my subscription in the mail as a child.
Yeah.
And so, for both of you, why is your company so committed to working with Caring and supporting mothers and their babies?
I can't speak to the data, but I do know that Yolaika and I sat with Caring at their consortium meetings where community leaders got together and discussed the mortality rate of Black women who, when they're pregnant, such high, staggering statistics, especially in North Carolina. It was eye-opening. And United Healthcare is very dedicated to, we always say it, making our members healthier. But when your boots are on the ground and you're in the community and you're hearing from those who treat people who are high-risk maternal, it just makes the purpose so much more beneficial. So I'm blessed to be on a company that allows us to sponsor many of their events, work together alongside of their team members, and just try and help promote and just be a resource to them. And it's so important, and to see a difference and to hear statistics at the end of the year of all the lives that Caring has met and changed, and that makes it all worthwhile.
Yeah.
Thank you for that perspective. And Yolaika, is there any additional insight you want to provide about your work in maternal and child health?
Yeah, I mean, it's just amazing partnering with so many, right? I come from, my background is really started off with early intervention. So going into the maternal child health field is pretty new to me, but just learning so much, learning from my team of, the OB provider nurses, and working with Caring. I've learned a lot just attending those consortium meetings that they have. So it's just partnering, right? It takes a village, and that's what we always say. It takes a village and it takes a community for us to come together and help our families and our children. And so just in the role, just giving back, being able to support, being able to just love, right? And it just takes a community for us to come together and help these women and children. So I think on that side, I just, like she said, blessed to be a part of the maternal child health team, being a part of that. I can go out to different communities or different organizations like Caring and, help with the additional support and resources that we have at United Healthcare.
Well, one, I can tell you're both passionate about the work that you do. So I want to thank you for your involvement in this space, for your commitment to this work. I wanted to shift just quickly based on something you said. Personally, what does it mean for you as women to be able to use your expertise and your skills in an area where you know that your work is changing lives? I'll start with you, Nicole.
Wow.
I know that's a big question, but
It's a big question. I mean, as a woman, I've been blessed to be a mom. I know not everyone has that opportunity. I find that I'm driven by my empathetic ways, and I don't know. I want to put my feet in other people's shoes and experience that and just walk alongside of them. And I don't know if I'm answering the question. I'm just trying to
you are.
it's so important. And even though we're one person, we're one organization here today, just kind of like Yolaika said, we all have to come together. So it's just an amazing community. It's just amazing. So yeah.
Well, I think, and I love what you said. You want to put your feet in other people's shoes. I've never heard it said that way, but that is a perfect
Yes,
description.
especially for the Black woman. Like I told you earlier, I was astounded. I mean, and then when we sat on these consortiums with Caring, we heard from young Black mothers who felt ignored, and just it brought to my attention what some people were going through that I had no idea. So it really allowed me to be in their shoes for 20 minutes
Right.
and see what they experience. And it's life changing.
And I'm sure it deepens the way you work as well.
Absolutely. I mean, it changes your life.
Awesome.
Just a better
Thank you for that.
understanding.
Yeah.
And Yolaika, I would say personally, how has this work affected you?
Wow. How has it affected me? I think it's just very more compassion and care. Myself also being a mother, and sometimes listening to their stories, I went back to kind of go through my journey and pregnancy and the things, and maybe there were certain things that I wasn't aware
Right.
that I experienced, and I was like, wow, like I was affected in this way, and I never thought about it that way because it was just
There
I
wasn't
had the
any
baby.
language.
Right. And so learning and hearing other stories, and now I'm able to support other moms. Like if I have a family member or a friend that is pregnant at the time, and I'm just like, okay, make sure that you advocate for yourself. Make sure that you're aware of all the signs. And so it just helps me stand by them, alongside them, and be an advocate for them and bring awareness that everybody's experience is so different. And, unfortunately for some, they may not be able to share their story. And so just wanting to make sure that it doesn't happen to that next person or that loved one that I know.
Well, I thank you both for being so open and so willing to share. And you have a wonderful rest of the conference.
You as
you
well.
so
Thank you so
much.
much for having us.
So you're welcome.